All right, folks, let's talk about CMAX. Yeah, I'm late. I'm sorry. I'm tired. Anyways, my name is Dr. Bahadi, fully licensed medical physician, fitness and wellness enthusiast, aka Captain Bummer, aka Mr. Keep It Real, aka Straight Shooter. Let's get into it. So, CMAX is an ACTH-derived peptide with activity at melanocortin receptors in the brain, which basically results in increases in BDNF, or brain-derived neurotrophic factor, which is a neurogrowth factor with roles in promoting neuroplasticity, aka forming new connections between neurons. It also has a role in the neuron life cycle, specifically in generation of new neurons, and it's shown to have influence in learning and memory. And basically, BDNF accomplishes all these various functions by binding to and activating TRKB receptors in different parts of the brain. Now, depending on what part of the brain is involved, the end outcome can be influenced. For example, in the amygdala, it's responsible for modulating fear learning and emotional memory. In the prefrontal cortex, it's responsible for attention and emotional regulation. In the hippocampus, it's responsible for memory formation, and in the striatum, it's more motor function. And low levels of BDNF are associated with various neurocognitive disorders, including Alzheimer's disease, Parkinson's disease, anxiety, depression, etc. So the results of preclinical studies using CMAX have consistently demonstrated that the drug is able to increase BDNF very quickly after intranasal administration. And CMAX also has been shown to increase other growth factors that improve cerebral vascularity and cerebral mitochondrial function. And in human clinical trials performed in Russia, it was shown that 2 6-day courses of intranasal CMAX was shown to improve recovery after stroke. So it all sounds excellent, which is where Captain Bummer comes in. So approaching the data and the use of CMAX from a more critical standpoint, there's a few issues that you can see right away. For starters, almost all the studies involved are kind of poorly designed, especially the studies in humans, because they're single center, unblinded, and a lot of them aren't placebo controlled. So there is a lot of potential for internal bias. Although, even looking at the data and taking the data at face value and assuming that it's all unbiased and the results were significant, there's still a little bit of an issue with how CMAX is currently being implemented by people. And this time it's not really a dosing issue, but rather a duration of treatment and the potential risks that are involved with chronic BDNF upregulation. And I don't think you can bypass this risk by doing something like a 5 days on, 2 days off, which I'm commonly seeing when people are, blind leading the blind when it comes to this stuff. But chronic BDNF upregulation could potentially lower seizure thresholds due to its own modulatory effect on GABAergic inhibition. So GABA is responsible for basically calming everything down. So basically you could end up with a decrease in inhibitory tone, so to say, and that can lower seizure thresholds, especially in patients who have epilepsy or other kinds of seizure disorders. It can also lead to chronic pain syndromes and fibromyalgia just due to BDNF's general central stimulation effects. And then, of course, since it is a neuronal growth factor, it's absolutely contraindicated in certain types of brain tumors because it can lead to accelerated growth and progression. Another thing that it can potentially do is induce manic and hypomanic states, since, again, it's fairly stimulatory. And lastly, it can actually reinforce some maladaptive circuits in patients who have PTSD, panic disorder, agoraphobia, because of the fact that it promotes long-term potentiation. So some of those connections that exist that you don't necessarily want to exist can basically cement themselves and solidify. So I think the potential benefits of CMAX are lovely. And I think some of these risks should definitely be considered more closely and taken into account. I don't think it's something that should be used chronically at all. I mean, even the longest studies that were performed in humans, it was only a few weeks of exposure and treatment. But the good news from all of that and the data that is available is that the effects that they did see seemed to sustain well beyond 3 to 6 months. So if you are going to use it, I think you should approach it with caution, especially if you have pre-existing psychiatric issues. And if you still want to use it, I think, as with any other peptide, identify your goal, address that goal, and once you've gotten to a point where you feel like you've accomplished your goal, to discontinue it. There's no reason to continue using something if it's not continuing to add benefit. And in a lot of cases, chronic exposure is what is exposing you to risk. Dr. Bahati out. We'll see you next time.